Hello, I'm Dr. Kurt Summersgill. I'm an oral and maxillofacial pathologist and the program director for the program at UPMC and the University of Pittsburgh School of Dental Medicine. Um, I'm doing this recording in May of 2024. So things may change or may have changed by the time you listen to this recording. Currently, we have 2.4 faculty members in oral pathology. So I'm a full-time oral pathologist here. Dr. Richard Vargo is one of our graduates, and he came back as a full-time faculty member. And then Dr. Joanne Prasad has been here since 2005, and she is 40% in the department as an oral and maxillofacial pathologist. So you would be exposed to all three of us from a pathology point of view. We also have two oral and maxillofacial radiologists. So they're an excellent resource and part of the program. And we have an oral medicine specialist as well, and she will be an excellent resource in teaching and for clinical patients. I've been program director from the beginning, so since 2008. We've had quite a few successful graduates. All are in pathology except one person, and he elected to go into more general practice, partially for financial reasons. So we're a pretty successful program, I think. We currently have two residents, one who's a third year who's going to finish her program and move on to a faculty position. And we have a first year who will move on to as a second year resident. So we have two incoming residents, incoming first year residents, and that brings up a major change in our program for 2024 and going forward. We have our traditional UPMC hospital-based residency program. And we can accept one resident to that program every year. That is must be a U.S. or Canadian dental school graduate. But just for this year, we've started a program at the School of Dental Medicine that permits us to review and accept international graduates with certain qualifications. That person would be a dental school resident. That program is tuition-based, and many of the people who would apply to this kind of program would have a sponsor, which would require them to go back to their original country and serve for several years. That program, the dental school-based program, does offer a master's degree as well as part of the tuition. Basically, there would be a few extra courses. Now, the pathology program at UPMC and at the dental school would have essentially identical training. Same faculty, same requirements to give some lectures. Same requirements for amount of biopsy cases that you might see in the biopsy service. The main exception just being that one was taking courses for credit, is registered for courses, and if they're going to do a master's, they need to take some additional coursework, research methodology, actual register for research credits, things like that. The UPMC-based resident is welcome to pursue a master's degree. We've only had one person over the year who has done that. And that was pretty stressful. Just was hard to juggle the two different programs at the same time. If someone at the UPMC program does choose to do a master's degree, there is some tuition support, but otherwise you would have to pay tuition as well and have to be accepted to their graduate program, whichever one you'd be applying to. One of us would typically be on your research committee, your master's committee, and I think all of us are qualified to do that. What else can I say here? Has a couple little notes here. Another major change coming up, just so you're aware of it, so there are no surprises. I have a fair amount of gray hair here, and I will be retiring in about 2.5 years. So in 26, 27, I will be retiring. One of our current faculty will probably take over my position as the program director, and the plan is to hire a person so we have a full complement of faculty. So just keep that in mind. What else can I say? The rotations are one real benefit to our program, I think, besides having multiple oral pathologists and radiologists and an oral medicine person to give you a lot of different perspective, is that rotations at UPMC, excuse me, are pretty wide ranging, and with some opportunity on your part to make some selections. There's a very strong head and neck pathology bench at UPMC, and we expect you to spend actually quite a bit of time with them. We are partially based with the dermatopathology department, and we expect to spend a fair amount of time with those as well. It's really important to get some derm path under your belt, because you will get biopsy. If you do end up in academia or in a biopsy service after you graduate, you will see dermatology cases. So it's best that we can recognize things and certainly keep them into within our specialty rather than having to send them out to somebody else. So good exposure to head neck pathology, derm path, lymph node pathology for things like lymphomas, or just infectious disease. Sometimes we end up having to kind of scratch our heads a little bit, say, what's really happening here? And a great benefit of being a part of this big university hospital complex is that we have a lot of resources we can go to just essentially across the street in many cases, or just down the block. And that's pretty much it. The rest of the information is on the webpage here, and always feel free to contact us. Applications starting this year will be exclusively in the PASS system, PASS, instead of, we used to have a self-managed system, but the PASS puts all the documents in one place. You can apply to multiple programs without much extra effort. Nothing gets lost in the mail, things like that. As it will say on our website here, our interviews are exclusively virtual. We use Zoom. If we have to use Teams, we can certainly do that. But right now we use Zoom. And so everyone has to do that. If you are able to and want to visit us just to see the city and see how our facilities are, how things work, you're certainly welcome to do that. But we would not interview in that situation. Everyone needs to be on an even playing field when they interview. So those are all virtual, typically in October or November when we would do that. And sometimes we give an almost immediate acceptance if someone just is outstanding. Otherwise, don't be too unnerved if we say, "Can you wait a little bit?" And then we'll let you know later on. That's pretty much it. Pittsburgh is a great city. It's fairly safe. It is very manageable as compared to a place like New York. I'm not going to downplay New York. I do like to visit there once in a while. I would not like to be there for an extended period of time. But there are plenty of opportunities out there. All the programs are really good. They're all just a little different. And so part of your investigation is to see how our difference benefits you and matches your interests. All right, that's it. So hope to talk to you. Thanks, bye.